Good evening. My name is Amber Broughton. I am sharing my presentation on Seymour Community Health Centers for the social work BLS presentation. Uh, so we'll get started here. I did my presentation on Seymour Community Health Centers, and Seymour is local to Grace Harbor, the Pacific Northwest, Washington. They are only in Washington State, and were originally created to help seasonal workers, immigrants have top priority health care and wraparound services. So CMAR offers a wide variety, mental health, dental, medical, case management for SUD services. They also offer maternity services and have recently added specializations such as cardiology, gastroenterology, and other medical services for their patients so they can kind of have all of their care in one location. Seymour Community Health Centers demonstrates how integrated care models can effectively support diverse community needs through coordinated services and accessible healthcare. Again, that's that wraparound healthcare, and they also are affordable because they offer a fee for service and a slide scale, which means that the patients can bring in their proof of income or lack thereof, and their services will be based on their income so that nobody is turned away for inability to pay for services. The other really great thing that CMAR does is their health homes program, which is integrated care management, is completely free to the community as far as they have to have certain qualifications, such as comorbidities like diabetes, heart disease, any kind of illness that would prevent them or create barriers to them being successful. The other thing is they get referred to us through their insurance leads, their Medicare leads, such as Molina, United Healthcare, things like that, to where the insurance companies place them on a scale due to their needs, due to their hospitalizations, their diagnoses, and it gives them a score. And once their score is high enough, then they send that referral to the care management team, and the care management team reaches out to them to see how they can help them, whether it's referral to healthcare providers, whether it is financial management, whatever their barriers may be, those case managers step in and try to teach and educate the patients on their best use of resources. So the agency's mission emphasizes building trust with patients while providing comprehensive care regardless of income, language, immigration status, or background. This approach reflects a commitment to health equity and community-based care, which are both essential principles in social work and case management practice. One important aspect of CMAR's delivery is of its use of multiple case management models depending on the needs of the population. Within the Health Homes program, the agency utilizes the resource coordination or brokerage model. This model focuses on linking patients to necessary services such as medical care, housing resources, or social services while empowering them to access and utilize those supports independently. Brokerage case management is particularly useful in large healthcare systems because it allows case managers to efficiently coordinate services while ensuring that clients are connected to the appropriate resources. So, in understanding how that works for CMAR, is that their wraparound services allow for patients who are seeking case management, their resources are quicker for people who are already involved with their organization, meaning that if they're a patient or and a patient means either medical, dental, mental health, or case management services. Once they are in any of those programs, they are automatically considered a CMAR patient or client, and they can have direct referrals to providers, which generally will help them be seen sooner on their level and and gives the providers more accurate uh, descriptions of the patient or client, their care, what they're needing, and so it's just more efficient all around to be able to kind of see everything that each provider is doing with that patient or client. Um, so, in contrast, CMAR's behavioral health and substance use disorder programs often implement blended case management approaches. Blended models combine elements of brokerage and intensive case management, allowing providers to both coordinate resources and maintain more direct involvement with clients who have complex behavioral needs. So, not only does the behavioral health utilize their case manager for resources, but those case managers sometimes do group and work with them individually on any kind of therapeutic needs that they might have that constitutes a barrier for them regarding case management. Uh, the flexibility is important because individuals experiencing mental health or substance use challenge often require ongoing engagement, advocacy, and coordination across medical, behavioral, and social service programs. By using different case management models across programs, CMAR is able to meet clients where they are and provide comprehensive and culturally responsive care. I think that CMAR does a really great job of trying to meet their clients where they are instead of where we want them to be or where they want them to be. And they really work individually with patients and clients to find their barriers, explore resources that will work with the patient and for the patient, and then educate on how those clients can find their resources on their own. So the step is to eventually graduate them to where they are able to stand on their own and say, if I need help with this, I know that I can go here. If I'm having a housing crisis, I know that this is who I can contact. If my electricity is going to be turned off, I know that these programs can help assist with those things. And so it's about empowering each client that comes in, no matter where they are. So thank you very much for watching my presentation. I hope that you have a wonderful evening.